Your headache might not just be a headache. You might have an undiagnosed migraine. Let me explain why. The main migraine symptoms are headache, watery eyes, facial pain, light sensitivity, sound sensitivity, visual changes, and a few others. But not everybody who has migraine conveniently has all of these symptoms like it's a textbook. Often people who have migraine might have a few of these symptoms or maybe even just one. And that's why it gets misdiagnosed so frequently. If you have migraine, you might only get headaches and none of the other symptoms. And for that reason, you might brush it off as normal and take painkillers to deal with it. And that's where you mess up. People learn to take medications whenever they get these headaches that for some reason never seem to end. Their body gets used to the painkillers. Now you have to take more painkillers. And now you've entered the vicious cycle of medication overuse headaches, which deserves a whole other video by itself. It's possible to have migraine and not experience a headache at all, and only experience facial pain and watery eyes, so you think it's a sinus headache. 90% of sinus headaches are in fact actually migraines, according to the American Migraine Foundation. One of the symptoms of migraine is light and sound sensitivity. So you might think it's your screen time that's giving you headaches when it is in fact migraine. If you're a woman, it's very likely that a doctor will probably write off your headaches as menstrual or menopausal when it in fact could be a migraine. That's exactly why you need to use Shafia to minimize the risk of misdiagnosis. We ask about all of your symptoms when doctors can subconsciously sometimes only focus on one. We ask about your whole general health picture when doctors can sometimes only focus on your symptoms. It would only take you a few minutes to answer some questions about that damn headache you've been experiencing for so long, which you've probably pushed to the side and misdiagnosed. It doesn't cost you a thing. Click the link in the bio.